It's a privilege and pleasure for me to share a dais with you, sir. Justice Akhdar was chair of Juvenile Justice Committee, and under his leadership, we could achieve a lot in Delhi. The reality is, in India, we are giving to underworld around 2% of India's GDP. In 1971, Richard Nixon, he declared war on drug. Until America is struggling because they never reduced their demand. They always thought that they will reduce the supply and the problem will be over. So please understand, there's a big cartels globally, because I work with UN, I work with the international community on a daily basis, so I understand where we are. We are in a very, very difficult situation. We have been running 3 treatment centers, one for girls, and the girls 8 years, 9 years, 10 years. Now they are drug users. A girl who is just 11, she is HIV positive. So situation is alarming. And alternate to incarceration is the only way out. And now in our treatment center, 6, 7, 8. And I invite all of you, please come and visit, then only you will realize where we stand. I have to give credit to Ministry of Home Affairs. They have done a very good job in the last 4 or 5 years. But the supply, the moment supply is reduced, demand is there, the price goes up. When price goes up, so automatically the supplier will come in some other way. And the poorest of the poor are used. Kids are used to courier drug, to traffic drug. So this is something which is very alarming. So what we need to understand, they should not be sent to jail. Don't punish them, treat them. This is Government of India data. Around 77 lakh people, they need treatment today. And around 2 crore people, 2.4 crore people are heroin and opiate user. 40 lakh kg of opiate is being used as on date today in the country per year, 40 lakhs. This is Punjab jail data of July. 47% are under NDPS Act and 40% are drug users. Thanks to again Ministry of Home Affairs that you have allowed treatment, and Ministry of Social Justice has allowed funding for people, those who are in prison for treatment. Unfortunately, it is not being managed the way it should have been. Just for your information, there are 4 stages of treatment. The first stage, that stage is called motivational interviewing. We motivate people for the treatment. See, this is a chronic brain disorder. Fortunately, in a criminal justice system, like what we had in a juvenile justice from board, the kids used to come with the order, and we treated more than 4,000 kids. And trust me, only few kids gave us trouble. Rest were excellent. It is easy to treat people because they are not criminals. They have a problem which needs to be addressed scientifically. Third is rehabilitation, where we have to focus more and more. This is the journey what we have done. This is my 41 years of investment in this sector. One center we have taken at Fatehgarh Sahib 2 months back. We are working on it, and we hope in next 6 months' time we will develop a model for Government of Punjab. And they have around 30 treatment centers, so they should be sent there. This was one time in 2010. Honorable High Court of Delhi asked us to start a treatment center. Before that, we have been working in the sector, but we had no clue how to work with the children, those who were in drug and crime. And no one gave us any trouble. On the right side, if you see, the White House people came twice to learn and understand how we are treating this particular population. And we were very privileged. Thank you. Honorable judges of Juvenile Justice Committee have been visiting on a regular basis. These are the people who came from 40 plus countries to learn. Because you see, in those countries, a child who is in crime is more dangerous for their system than an adult. The worst part is it is closed. Last year, Government of Delhi said, we don't require it. It's closed. Anyway, so somewhere we have to understand there are kids. Chemical drug is here. Unfortunately, globally for chemical drug, there is no treatment as on date. It gives high. It creates mental health problem. They start, self-harming themselves. So we need to think differently, and only way out is demand reduction. We have developed a module called Navchetna, which has been taken by Government of India, Ministry of Education, Ministry of Social Justice, and around 1 million teachers, they are being trained. So that is the only way. We have to ensure that no child starts using drug, or if they have to use it by any chance, as long as we can delay that first use. So I'm utilizing this opportunity to sensitize all of you that any person coming in the prison, if coming from the drug using background, should be provided relief withdrawal management. Every prison, wherever they have a treatment center inside, they should have a halfway home outside, and it should be funded by the state. Yeah, this is very important, sir, for you, sir. Large number of treatment centers which are unregulated, scientifically not correct, and there is a very good judgment by Justice Muralidhar ji. A treatment center which does not have doctor, doesn't have counselor, doesn't have human right, should not exist. Thank you.
So one of the recommendations, and this is my request to my friend and someone who I admire and I know who can take things forward, is to recommend to the various state governments, and you can start with Delhi for example, that please set up proper de-addiction centers. What they have is 1 or 2 beds in a major hospital. That doesn't solve the problem. And I can tell you from my experience, I had someone from the court who was given as staff to me. He took to alcohol, and he became an alcoholic. I requested Dr. Rajesh to treat him. I sent him to the center. When I spoke with Dr. Rajesh, he told me that he has to come back, and that was a learning for me that this doesn't happen at one go. So he went once or twice, and today he's working with me because he moved when I debated office. He moved with me. The boy is working with me. He's completely cured. Touch wood. And I can trust my house, my child with him. What about you, Dr. Rajesh? Anything else that you want to say to the audience?
Coming generation is in trouble and they should not be in prison. All the NDPS code from Delhi, we can initiate the process, and I'm ready to provide free of cost treatment to all of them. Let's take one code in Delhi of NDPS. I'm not talking about the violent and heinous crime, where the judges can feel that okay, the person should be sent to the treatment program. So let's just start with one code. It could be any code. Your office can ask Delhi government if the center was closed last year, which was global best practice. Now what is happening with the children, those who are caught with drug and crime, and now they are in big trouble. Earlier, the OHB used to have around 100 to 120. Now they have more than 300 inmates. Now it has become again back to revolving door. They come in the prison, OHB, they get bail, go back, commit crime. Sir, one child is using at least 4,000 to 5,000 rupees a day for one day drug. And we have all the data. If you are interested, I can provide you authentic, credible data from the system.
Yes, please.
Follows all crimes also.
Yes.
Yes, 4,000.
So a pilot can be
5,000
done.
rupees means it leads to only.
Right.
Yes.
And then the footprint can be kind of expanded.